Okay, so today we are starting seated. Any comfortable seated position, you could cross your legs, bend, you could fully straighten out the legs, which is what I'm going to do. I just want you to think of a piece of string pulling you tall to the ceiling, so you're just growing a little bit taller here. We're going to reach the arms forward from wherever you are. Be careful that you're not popping out the rib cage. I think you just corset around the rib cage, drawing the rib cage in slightly. Take a breath, and then exhale, we're going to lift arms overhead. Inhale to drop, and exhale to lift. We're just going to take 3, 2, and then next time the arms are overhead, you're going to keep them there. Take a breath here. And I want you to imagine you've got a huge big beach ball in front of the belly, and you're going to dive over that imaginary beach ball and reach it forward, flexing the spine. Inhale to pull it back. And again, you can do this from bent legs or cross-legged if you prefer. We're reaching forward, purposefully allowing the back to bend, chin comes towards the chest. Inhale to restack, and again, we're just going for 3. Nice deep breath as we go back toward. Be careful that your shoulders aren't kind of coming up towards the ears at that point. And then this time allowing the spine to stay slightly flexed, slightly round. We're just going to place the hands either side of your hips. And if you haven't already got straight legs, we're going to bring them straight. Okay, so I'm not in that super tall spine position. I've got a little bit of kind of pulling back into the belly button, and then from there, if you pay attention to my feet and my ankles, what we're going to do is point toes, flex toes, or it's what we call dorsiflexion and plantar flexion through the feet. So just pulling the toes up towards the body, pointing them away. And we're just going to take 4, 3, 2, and then next time, keeping the toes pulled to the body, growing a tiny little bit taller here, but not losing the core. So still want you to imagine you're drawing your belly button back behind you, keeping the hands placed to the floor. Take a breath. I want you to push the hands into the floor as we breathe out and lift one leg. Now you're not going to get that leg very high. You might struggle to actually get it off the floor at all. And if that's the case, go from here instead. So the straighter you have the legs, we're just alternating left, right here. The straighter you have the legs, the harder that will be. It might be that you have them bent, but only slightly bent, or it might be that you can manage it straight. But make sure, if you're going for straight, make sure you're leaning slightly forward and you're not back here, because it does take away from the exercise being quite hip dominant. And we're going to go 6, switching from left to right, 5, 4, 3, 2, last one here, and then if you choose any comfortable seated position again, it might be that you want to swap, growing back into that tall position, shoulders relax down, take a breath. We're just going to walk hands around to one side. Now if you've got anything like subluxing ribs, slipping rib syndrome, please make the twist really tiny. It's not even a half twist, it's a 25% twist. If you've got no contraindications, nothing that would be risky in this movement, you can make that as big as you like. It might feel quite nice, kind of almost using the arms to wedge you round and stretch out the back slightly. And we're just going to take another 4, so 2 more each direction. 3, so breathing out into the stretch if you can. Nice deep breath in the middle, 2 more. And last one. Section. We're going to repeat kind of similar to what we've just done a moment ago. Starting tall with the legs bent. How bent you have them is really up to you. Just make sure you've got a little bit of space behind you. We're going to grow tall. You can either have hands on legs, maybe around the back of the thighs for a bit of support here, or maybe even crossed over your chest. So having the arms away from the legs is a little bit more challenging for your core. We're going to grow, again, think a piece of string to the ceiling, grow nice and tall. Take a breath. I want you to imagine you're pulling your rib cage down towards your belly, down towards your pelvis slightly. We're tucking through the tailbone, so you're kind of tilting in and out of the pelvis here. That's really important, almost as if you're trying to pull the base of the spine underneath your bum. Okay, that's the movement we're doing. Pelvis tilts, rib cage almost draws downwards, and we're just kind of almost coming away from the sitting bones as far back as you feel comfortable. If you do not feel comfortable going that far, just make it smaller, such as this. Or even slightly supported by using the legs. Grow a bit taller as we unravel. Breathe out, we tuck. So it should feel quite strong on the front of your core, right around where that belly button is. You can have toes lifted if you prefer. If you're getting a lot of pain under your, around your lower back, you might want to sit on a cushion and wedge yourself up slightly. So it's a move that we call a C curve, and the idea is as you roll back, the spine kind of briefly mimics the letter C, C shape. Okay, we're just going to take 2 of those, any arm position you like, big or a small, roll back as you like. On your next one, we are going to hold. So if that feels quite strong, don't go any further back than that. You just have to find your kind of sweet spot you can maintain, you haven't got any bad pain, and you can still breathe. If you prefer at this point, hands could be to the floor. Think of scooping the belly button down towards the floor, kind of breathe out. Alternating again, left and right. So it's a very similar move to what we did a moment ago, but it should be that a little bit stronger because of your engagement through the front of your core. So if you don't need your hands down, hands again could be here. I want you to breathe out as the knee comes towards the chest, and you're keeping a nice alignment through the left and right leg. So right leg, right ankle, right knee, right hip, all nice and aligned. Same on the left. We're just going to take 4. Breathe into lower, breathe out, lift, swap. 2. Last one. And then this time, we're going to roll onto your left hand side. Now we do have 2-3 exercises on each side. What I'm going to do is break it up in the middle. So, welcome to have a cushion, a pillow, a rolled up towel underneath your head if you prefer. Stack the hips, so be careful this top hip isn't kind of rolled back behind you. They're stacked on top of each other, the knees are stacked, the ankles and the feet are even stacked. And you can choose whether to be propped up like this. Just be careful, it does sometimes give you a little bit of a sore neck. You might prefer to be completely lying, such as this. Oh, I don't mind this today. It's not usually my favourite position because it tends to sag the rib cage down into the mat. But if you can kind of keep a little bit of a lift here, that's okay. So you just choose your preference for your setup. The feet and the knees are towards the front of your mat, or if you're not on a mat, slightly ahead of you. So just be careful that they're not wedged kind of back behind you. That's your setup. Tiny lift through this bottom waist. So if you could tickle your fingers underneath, you've got, I'm lying on my left side, you've got your right hand free to be here or here. All we're going to do to start with, take a breath, pick up this bottom waist, breathe out and lift. I'd say ever so slightly higher than hip height, but not much more than that. The leg stays bent as you lift. If you're not sure about the hips, maybe place that right hand on a hip, on the right hip, sorry, and it just helps you kind of focus on whether it's staying stable or whether it's rolling back behind you, which we don't want. So bottom waist, left waist is picked up. Lifting the top leg, which is my right leg. And remember to take a rest anytime you need to. It does get quite heavy around this top side, this side of the hip, kind of towards where your glute medius is. And if you're a little bit like me and you have problems with your hips or sciatica, you might need to rest a little bit sooner. We're just going to go for 2. And on this last one, we're then going to keep it lifted just for a moment. Remember, keeping this bottom waist lifted. We're going to hold for 5, 2, 1. Quick rest. We have one more exercise on this side before a quick break. Again, pick up this bottom waist. Choose how you want your head supported. We're actually going to start now lifted exactly where you just were. Pull the toes up towards the body. Take a breath. want you to imagine you're pushing a slab of concrete away from you, so something really, really heavy. And then inhale, just so the knees is back to stacked. I don't want to see the knee, or I don't want you to think about the knee coming right into the chest. Knees start on top of each other, breathe out. Imagine you're pushing something heavy away. Breathe in, we've only got 6. Remember not to let this bottom waist sag into your mat. And 4. 3. 2. And here is your last one. Rest it down. Now we do have one more exercise this side, but just to give this side of the hip, side of the bum muscles a rest for a moment, we're just going to transfer to lying on your back just for a moment for a set of shoulder bridges. So again, line the feet, the knees, the hips up, arms just place them down by the side of the body or with the fingers lightly on the top of the hip. I want you to take a breath, imagine you're rolling a Malteser or a marble, something really small, into your belly button, and the lower back will really tighten flat into the floor. That's your start point for a breath in. And then as you start to breathe out, we're taking one vertebrae at a time. So you start with your bum, lower back, mid back, last, away from the floor. And then rolling until you've got hopefully a fairly straight line from the knees through the hip towards the top of the rib cage. If you find that you've gone too high, you tend to feel it in the lower back, and that will be a little bit overextended. So just be a little bit careful with that. Roll nice and slowly away from the floor, hands on hips or down by side. We are engaging through the glutes, but remember, not too high, also not too low. So you might be able to have a little look and see what your angle is like. If your hips are significantly lower than your knees, you need to just try, as long as you don't have any bad pain, try and raise into that extra height. We roll back down on an exhale. Again, it's one vertebrae at a time, so the last thing to touch down should feel like your bum. We're just going to take another 3 of these. Tilting the pelvis first. Remember, imaginary marble rolls into the belly button. You're then lifting one vertebrae away at a time. Nice deep breath at the top. And then rolling again, nice and slowly and controlled back down. We've just got 2. Breath in at the top. And then exhale. To melt back to your mat one last time. Okay, we're going to let the knees drop towards that left side one final time. We are going to come back to lying on your left side. Or if you did your right side first, go back to lying on your right side. So we're just repositioning one final time. Getting the head supported on your cushion pillow by your head. Having the head by your hand, whatever. And then we're going to bring the hips back to stacked. Now this time the top leg, which is for me is my right leg, I'm going to go pretty long. I'm pulling the toes up towards the chest. I've got some flexion through the ankle. I'm again lifting this bottom waist just so I can tickle the fingers underneath. And then just slowly going to drive it forwards, keeping it at about hip height. Pull it back, breathe out. Now the further forward you go with your leg, the harder this is going to feel. So if you're not sure and if you've got any problems with your hips or you've got any sciatica, anything like that, I would suggest start small. So just swooping it forward, taking a breath in, breathing out to pull it back. You'll be a little bit careful if you're hypermobile in your hips as well. Sometimes the leg likes to just kind of swing right forward and you lose your core stability slightly. So breathing in, swinging it forward, breathing out, pulling it back. We've just got 4. Two more. And last one. Dropping that leg when you're ready. We're going to come back to those bridges we did a moment ago. free second round. And then we'll start all of that from the opposite leg. So placing the feet flat on the floor, legs bent, arms by side or hands on hips. Take a breath, tuck the pelvis, tilt the pelvis, create that hollow sensation through the lower belly, and then start working again one vertebrae off at a time on the exhale, pausing at the top for an inhale, and then exhaling again back down. We're only taking 3 in total here, so we're only doing 2 more. Tilt the pelvis, be careful of the ribcage not sticking out, so as you start to work, this shouldn't feel a little bit flatter. Bum comes off first, lower back to mid back, towards shoulder blades last. Final time coming up. And then rolling nice and slowly back down. You guys are going to let your legs, or just make sure you've swapped sides. Your legs, if you're with me, you're going to be lying on your right side next. Let the knees sink to the right, and then you're going to roll over. I'm going to completely reposition so you can see me okay. So make sure you swap sides. Head on a pillow, head supported, head lying flat. You choose. Create this little bit of space under the right waist, or the bottom waist, whatever you've chosen here. The hips are stacked, the knees are stacked, and the feet are stacked. Take a breath. We breathe out to lift, keeping the leg bent, not too high, slightly higher than hip height at the most. Inhale to lower. Just be a little bit careful as you continue to work through these, that this bottom waist doesn't kind of collapse into the floor. I want you to try and keep just underneath where the ribcage would be, as if you're trying to tickle that away from the floor. We're just taking 3 here. 2. And keep it lifted on this last one, unless you need a break, in which case pop it down. Pull the toes up towards your head. Take a breath. Breathe out, we go long. Breathe in. Remember, we're just bringing the knees over each other and not knee to the chest. Same as before, I want you to picture pushing something really heavy away from you, just so you're not kind of doing this with no tension. Again, we just got 4, 3, 2, and then final one. Come back down and have a rest. Alrighty, I'm going to roll onto your back just for a moment. We are going to bridge again, a slightly different version. Okay, so same setup as before. Feet, knees and hips aligned. Hands down on your mat, on your hips if you prefer. We're going to roll up the same way as before, so 1 vertebrae at a time, creating that setup. And then we're just going to shuffle your heels a little bit closer in towards your bum. Okay, or you might want to start on the floor with them a little bit closer, but I haven't got as big of a gap here. Okay, we start in the bridge. I want you to do this really, really slowly. If it's not an exercise that suits you, please just stay with the bridge as we were before, up and down. If you're okay here, I really want you to make sure you're using your glutes, your bum muscles. Take a breath, push with the right foot into the floor, when pick up left. Place it back down. We breathe out, we just do a swap. Right leg. We're only here for 6 in total. Remember, if it's not for you, you're just going to roll up and down from your bridge. We only have 3. Be careful on these last couple that the hips aren't right down towards the floor. We keep them lifted and aligned with the knees. Last one. And then in your own time, slowly melting back to the floor. Coming to lying on that second side. For me, it's my right side. 1 final time. Pick up that bottom waist. Stack the hips on top of each other. We're going to extend that top leg. Pull the toes up towards the chest. Take a breath in, swoop forward. Breath out, pull it back. And remember, it's up to you how far forward you go. Same as before, if you're hypermobile, be careful you don't swing right forward and lose your core. Well, that applies to everybody actually, but you're probably at a little bit more risk if you're hypermobile. Anything like sciatica, I'm now working my bad hip, my sore hip, so probably wouldn't go as far forward for me on this one. And we're just going to go for 3. The last one coming up here. And then pull it back. I'm going to ask you to roll onto your back a final time. Take a moment here. Hug one knee in and then swap. You could hug both knees in. Depends what your body feels like it needs. We're just going to stay here for a minute. You might want to hug the knees in but widen through the knees, so open the hips a bit more. You might want to rock a little bit side to side. I'm going to suggest you close your eyes just for a moment. Take some deep breaths. When you feel ready, if you haven't already, placing both feet back to the floor. I want you here to come back to that sensation. Imagine you're rolling a Malteser into your belly button, so tilting the pelvis and almost anchoring the lower back nice and flat into your mat. So you haven't got any big gaping holes here. The spine is not kind of overarching. We're just anchoring it down slightly. Don't worry if it doesn't feel really tight down, but I want you to imagine you're drawing your belly button down towards the floor, so your core, even just here where we're not doing anything, your core is switched on. When you take just arms relaxed by the side of the body, you're welcome to have a cushion or a pillow underneath your neck or your head. I'm going to lift the right knee, and then from there, pointing the toes up towards the ceiling, you're going to lower down, take a breath. You're going to decide how low you go, breathe out, lift back up. Now if this feels really heavy on the leg, or your hips, your hamstrings don't feel good, maybe just do it with a bend in the leg, such as this. Okay? Straight if you can, bent if you need to. How low you go is entirely up to you. We're breathing in, dropping down, breathing out, lifting back up. And every time, we're staying on the same leg, so we're not swapping side to side. Every time the leg picks back up towards the ceiling, I'm thinking of drawing the belly button down towards the floor. I'm going to aim for 5. If 5 is too many, just do 2 or 3. 3 to go. And we're really trying to keep this anchor sensation through the lower back so it's not moving around. The pelvis is not swaying side to side. And I'm quite level around the pelvis and hips. Alrighty, from there, let's place that right leg down and extend or bend the left. Toes pointed if you can. If you have anything like tingling in your feet, you might prefer to actually flex into the ankle a little bit there. Hands wherever is useful, can always take them to the side of the hips. Take a breath, we drop down. Breathe out, we lift back up. We draw the belly button to the floor as we are lifting the leg back to the ceiling. Remember, you can do this from bent if you prefer. I want you to stay really steady in the rest of your body. So we're doing a little bit of kind of hip strengthening with pelvic stability and a little bit of gentle core engagement here. I'm going to do about another 4. 3. 2. And last one. And then from here, I just want you to let the knees drop over to one side. Don't worry if they don't touch the floor. You might prefer your arms a little bit further away from your body. Take a breath as you breathe out. So we're just going to go through the middle and then over to the other side. Okay, so coming back to that same position with the feet, well, the feet certainly starting flat. We're going to reposition back where we were. The toes are pointed up towards the ceiling. Again, if it's too strong, you can always go with a one leg bent instead in the air. So I have my right leg lifted. Instead of dropping down and up, I'm going to make it, imagine you're drawing a circle. Start small, because what I want you to do is stay really, really level through your pelvis here. And what would happen if I went too wide? My bum cheek on the other side would come away from the floor. I've lost my pelvic stability, I've lost my core engagement. So small. We're breathing out to make the circle, inhale to complete it. Now to make this more challenging, if you want to, you would start with your leg a little bit lower to initiate that circle. And your circle can be drawn with a bent leg. So you choose which direction you're going. I want you to start really small. If you notice you're rocking around a lot, you've probably made it too big. You need a little bit more tension around your core. I want you to breathe really well with this so you're not holding your breath. And we're just drawing a continuous circle on the exhale. I'm going to take about another 4. Everything else in your body should be still. 3, 2, and 1. Sweep it in. Let's do a swap, legs bent or straight. Remember, you can start right from the ceiling, you can start a little bit lower down. Start into those circles on your exhale. Inhale to complete the circle. I'm going to take 6, 5, 4. This is definitely, you can tell this is where I have a sore hip on this side, because this other side, which is my kind of part of my stabilisation, is wanting to go with the movement, which is not what we want. Alrighty, and I'm going to make that one there your last one. Draw up. Again, I'm just going to ask you to bring one knee, both knees, if you prefer, into the chest. If you're doing single sides, just swap after about 5 seconds. If you want to add another final rock on the spine, you are welcome. And we're just going to move into a couple of stretches. So when you're ready, dropping legs back to the floor. Slowly going to transition. Please don't go too quickly. Over to one side. And then into a kneeling position. I'm going to give you a couple of options here. You might want a cushion or a towel under your knees for a little bit of support and cushioning. We're going to, please be near a wall if you're quite wobbly. We're going to bring one foot forward. And then what I don't want you to do, where Pilates is a little bit different to yoga in this sense, or I find it a little bit different. Yoga, and it's great for so many things, it tends to do a massive step forward and a real big opening here. And in Pilates, we don't make that quite so big. What don't we concentrate on instead? In fact, if I do it the other way, you'll be able to see it better. Is this back bum cheek is squeezing into it slightly. So you're almost pushing this hip forward, squeezing this side here, pushing this forward, and almost like tilting your pelvis a little bit to find the stretch, or rather than the stride to find the stretch, okay? Now if you can't find the stretch once you feel like you've got your hip flexors pushed forward slightly, that's when you might wriggle a little bit more length into that front leg. But so I want you to find the stretch to feel it here. And we're just going to hold for about 5, 4, 3, 2, 1. Before we swap legs, I want you to now purposefully take the weight back. See if you can get a little bit of length into this front leg. You might even be able to pull your toes up towards your body. You might need to lean your hands down or have maybe one hand placed through a wall for a bit of balance. And hopefully you can feel a bit of a stretch for the back of this leg. On your next exhale, we're just going to rock it forward and do a swap. So, find about a 90-degree stance to start with. Remember what I said, almost want you to think about squeezing into this back bum cheek to push the hips and tilt the pelvis, pushing the hips a little bit more into the stretch. Make sure you can feel at the very top of the thigh on the back leg. And again, we're just going to hold for 5, 4, 3, 2, again I'm going to transition, hinging back, moving the hips and the bum back, Lengthening this front leg, pulling the toes towards the body if you can. You can lean the chest down, you can stay tall, hold onto a wall or a chair or a sofa or something. On your next exhale, we'll release forward. We're going to come to seated. Final time. And if you can, starting with the knees together and just letting the knees sink slightly out. Now this is where you're going to be a bit careful if you're hypermobile, because you might find the knees just splat to the floor. So I don't want you to do that. I want you to, if needed, if you're hypermobile, hold on to the knees and then lean forward into the stretch. Okay, so my soles of the feet have kind of come together there. Not too worried if you can't feel the stretch, as long as you're in the stretch. So you don't want to be leaning backwards. If anything, weight forwards. Hopefully you can feel a little bit of opening around the groin. And we're just going to stay here for 5, 4, 3, 2, 1. Now choose any comfortable ending, seated, kneeling position, standing if you prefer. Grow that a little bit taller. And then we're just going to drop chin down towards the chest really, really slowly so you don't get dizzy. And then keeping the chin towards the chest, looking to the left armpit, slowly to the right armpit. We're going to swap it back to the left. Last time right. Bringing the chin through the centre of vision, then back forwards. I'm going to roll shoulders for 5, 4, 3, 2, and last one. And you are all finished.